discussion is going to be on laboratory tests and values, Evolve 12. The objectives are to become familiar with common types of laboratory tests and values, become aware of the importance of teamwork and nuance in clinical decision making regarding physical therapy treatment for patients with varying laboratory levels. Question for the day. A physical therapist assistant is working with a patient who has a history of chronic kidney disease. The supervising physical therapist orders a review of the patient's blood urea nitrogen, or BUN, and creatinine levels. What is the primary reason for assessing these lab values in this patient? A, to evaluate the patient's liver function and risk of jaundice. B, to determine the patient's hydration status and kidney function. C, to assess for electrolyte imbalances affecting muscle contractions, or D, to identify possible infections that could delay healing. Why do we need to know lab values? PTAs must understand lab values and ensure safe and effective treatment. Shorter hospital stays and more complex patient conditions make early PT consultation crucial. Abnormal test values may require treatment modifications or contraindicate therapy. PTAs should assess the entire clinical picture, consult healthcare professionals, and weigh risks before proceeding with interventions. Abnormal values serve as cautionary or warning flags, guiding treatment adjustments or cancellations when necessary. Monitoring vital signs and modifying therapy intensity based on test results are essential for patient safety. Longer life expectancy and more complex medical conditions lead to multiple health issues affecting the neuromusculoskeletal system. Routine monitoring of vital signs and laboratory values ensures safe and effective treatment. Lab values help identify precautions or contraindications, especially for exercise-based interventions. The APACHE, or Acute Physiology and Chronic Health Evaluation System, predicts outcomes for critically ill patients based on various physiological and laboratory values collected in the first 24 hours of ICU admission. It calculates a predicted death rate and estimates ICU length of stay. Key measurements include vital signs, blood gas levels, hematologic values, Glasgow Coma Scale, and serum markers. Lab values are used for screening or detecting hidden illnesses, diagnosing, or monitoring. Some tests, like glucose levels, serve multiple purposes. Screening helps identify at-risk individuals. Lab values guide therapy decisions, whether to proceed, modify, or delay treatment based on patient's condition. Some abnormal values contraindicate therapy, while others suggest modifying intensity. There are limitations to lab testing. Test results may be affected by contaminated mishandling, sample timing, medications, age, sex, pregnancy, or hydration status. Reference ranges vary across labs and should be interpreted using the specific lab standards. False positives and false negatives are possible, particularly when testing for rare conditions. The more tests conducted, the greater the chance of incorrect conclusion due to statistical probability. Tests are often repeated to improve accuracy. Basic Metabolic Panel, or BMP, is a group of 8 tests assessing electrolytes, acid-base balances, kidney function, and blood sugar levels. It includes sodium, potassium, chloride, calcium, blood urea nitrogen, or BUN, creatinine, glucose, and carbon dioxide. It is used for routine screenings, inpatient monitoring, and diagnosing medical conditions. It can also help detect kidney failure, insulin shock, or diabetic coma, and respiratory distress. Sodium regulates fluid balance. Imbalances can lead to neurological dysfunction, coma, or death. Potassium is essential for muscle and heart function. Imbalance can cause arrhythmias or cardiac arrest. Chloride and bicarbonate help regulate acid-base balance. Imbalances indicate metabolic acidosis or respiratory disorders. Magnesium is important for muscle and nerve function, but is not part of BMP, but is often ordered separately. Glucose is measured to assess for diabetes. Fasting glucose and glucose tolerance tests are common. A1C test measures long-term blood sugar control by analyzing glucose-bound hemoglobin over weeks or months. A comprehensive metabolic panel and hepatic function panel. Comprehensive metabolic panel, or CMP, includes all basic metabolic panel plus liver function test. It is used to assess kidney, liver, and metabolic function. Liver tests can also be ordered separately as a hepatic function panel. Hepatic function panel. The liver filters toxins and bacteria. Dysfunction increases the risk of multi-organ failure. No single test confirms liver disease. Physicians rely on multiple tests and clinical observations. A complete blood count, or CBC, is a routine lab test used to assess the general health of individuals and detect a variety of conditions such as infections, anemia, blood disorders. The test evaluates the levels of red blood cells, white blood cells, and platelets in a blood sample. Red blood cell count measures the number of red blood cells that carry oxygen throughout the body. This value is directly related to the person's endurance and their ability to tolerate changes in posture, also known as orthostatic hypotension. Anemia is a condition where red blood cell count is low, indicating reduced oxygen carrying capacity. The causes of anemia include vitamin deficiency, chronic disease, or iron deficiency. Ferritin is a protein that stores iron in the body. Low levels suggest iron deficiency, anemia, while elevated ferritin levels may indicate chronic iron excess or diseases like hemochromatosis. Decreased RBC count, hemoglobin, or hematocrit levels usually necessitate further tests to determine the underlying cause. WC count, or white blood cell count, measures the total number of white blood cells which are crucial for fighting infections. The platelet count measures the number of platelets which are essential for blood clotting. Blood tests help to determine the underlying causes of abnormal blood counts and can guide the diagnosis of conditions such as bone marrow disease or cancer. Specifically, tests are conducted to evaluate the characteristics and subpopulations of different blood cells. A bone marrow aspiration or biopsy is a test that is critical for evaluating blood formation, especially when there is a suspicion of bone marrow disease or cancer involving the bone marrow. It helps to identify blood cells that are precursors in any abnormal or malignant cells. Here are some tests of red blood cells. Hematocrit is a test that measures the relative volume of red blood cells as a percentage of total blood volume. Low hematocrit indicates anemia, but anemia may still exist even with a normal relative RBC volume. Hemoglobin concentration measures the amount of hemoglobin in the blood, which directly impacts the oxygen carrying capacity. A low hemoglobin concentration could indicate anemia, even if RBC count is normal. Anemia with normal hematocrit, but low hemoglobin is common in certain diseases. Mean corpuscular volume, or MCV, measures the average size of red blood cells and helps in diagnosing different types of anemia. Elevated MCV indicates possible vitamin B12 or folic acid deficiency. A decreased MCV indicates possible iron deficiency anemia. RBCs may change in shape in certain diseases. In sickle cell disease, red blood cells are crescent-shaped, as an example. Reticulocyte count. Reticulocytes are immature red blood cells. An elevated reticulocyte count indicates that the bone marrow is compensating for RBC loss, often due to bleeding. A high reticulocyte count is termed reticulocytosis, a sign of the body's response to blood loss. Iron is necessary for the production of hemoglobin, which allows RBCs to carry oxygen. Iron deficiency leads to the production of small, pale red blood cells. Both vitamin B12 and folic acid are essential for red blood cell production. B12 deficiency can cause a form of anemia if absorption is impaired. B12 is absorbed in the ileum and requires intrinsic factor from the gastric mucosa for proper absorption. Folic acid deficiency leads to large immature red blood cells being released from the bone marrow. Folic acid is crucial for red blood cell and white blood cell function and must be absorbed from the intestinal mucosa. The erythrocyte sedimentation rate, or ESR, is a nonspecific test used to detect inflammation in the body, which can be caused by a variety of conditions such as infection, autoimmune diseases, or even cancer. Although not directly related to anemia, the ESR is often included in tests related to red blood cells. The analysis of white blood cells, or WBCs, is crucial in diagnosing a range of conditions, as WBCs play a role in the immune response. A white cell differential, or DIF, helps assess the relative number of different types of white blood cells, which can be critical in identifying various diseases. Neutrophils are the most abundant type of WBC and are primarily involved in fighting infections, especially bacterial. Basophils are involved in allergic reactions and immune responses. Elevated levels are often seen in allergic conditions. Eosinophils are elevated during allergic reactions, parasitic infections, or conditions like eosinophilia. Monocytes are large white blood cells that migrate into tissues during infection or inflammation and become macrophages once in the tissue. Macrophages help remove pathogens and debris. Elevated monocytes can indicate chronic infections, autoimmune disorders, or inflammatory conditions. Lymphocytes are broken into B cells and T cells. B cells produce antibodies that fight pathogens, while T cells are divided into helper T cells, or CD4, cytotoxic T cells, CD8, and suppressor T cells. Helper T cells assist in regulating immune responses, while cytotoxic T cells destroy infected cells. In HIV and AIDS, there is a reduction in the helper T cells, or CD4, leading to immunosuppression. Abnormalities in T and B cell populations can indicate autoimmune diseases, chronic infections, or immunodeficiency. Hemostasis refers to the process that prevents and stops bleeding, involving the formation of blood clots. Both excessive and deficient hemostasis can cause health problems, so tests related to coagulation are important. A coagulation profile includes tests that assess platelet count for clotting efficiency, coagulation factors, which are enzymes and proteins, such as fibrinogen or prothrombin, required to form a clot, and calcium, which is essential for clotting pathway. Deficient hemostasis can lead to conditions like hemophilia, where blood doesn't clot properly, leading to excessive bleeding. Excessive hemostasis can result in thrombosis or clot formation, inappropriately leading to conditions like deep vein thrombosis or DVT, pulmonary embolism, or stroke. Tests such as prothrombin time or PT, activated thromboplastin time or APTT, and INR, which is International Normalized Ratio, are commonly used to evaluate clotting function and manage patients on anticoagulant therapy. Now we're going to discuss cardiac biomarkers, which are used for heart conditions. BNP, or brain natriuretic peptide, is released when the heart is under stress, such as heart failure. High BNP equals worsening heart failure. BNP levels more than 100 equals heart failure is present. 300 to 700 is moderate heart failure, and more than 700 is severe heart failure. Troponin is the best marker for heart attacks. It remains elevated for days. Troponin is a muscle-specific protein that is highly specific to cardiac muscle, making it an excellent marker for myocardial injury. Slight elevations indicate unstable angina, or MI, myocardial infarction. Troponin levels are useful in predicting long-term outcomes with patients with acute chest pain and MI. Creatinine kinase, or CK, is found in 3 forms. CKMM, found in skeletal muscles, CKBB, found in the brain, and CKMB, found in cardiac muscle, and is used as a marker for myocardial injury. Myoglobin quickly rises after heart damage but returns to normal fast. Myoglobin is a small protein involved in oxygen storage in muscle cells. It is released into the bloodstream immediately following muscle injury. Myoglobin levels rise 2 to 3 hours after myocardial injury and peak at 8 to 12 hours. However, myoglobin levels return to normal within 1 to 2 days, which may limit its utility in diagnosing delayed cases of MI. CKMB, when elevated, suggests cardiac muscle damage and are used in diagnosing MI, or myocardial infarction. Troponin is the most specific marker for myocardial injury. It is elevated in MI and predicts long-term mortality. Myoglobin rises quickly after muscle injury but returns to normal quickly, limiting its use for delayed diagnosis. And LDH is elevated for several days following tissue injury and is useful for detecting damage when other markers are no longer elevated. Here we're going to talk about lipid profile. Triglycerides provide energy for metabolism and are necessary for fat storage. Elevated triglyceride levels can increase the risk of heart disease. Cholesterol is a lipid used to build cell membranes and produce hormones. Cholesterol is carried in the body by lipoproteins. Low-density lipoproteins, or LDL, is often referred to as bad cholesterol. LDL carries cholesterol to the arteries. High levels of LDL are a strong predictor of atherosclerotic cardiovascular disease and coronary artery disease. High-density lipoprotein, or HDL, is known as good cholesterol. HDL helps remove excess cholesterol from the bloodstream, transporting it to the liver for processing. Low levels of HDL are a risk factor for cardiovascular disease. C-reactive protein, or CRP, is a protein produced by the liver in response to systemic inflammation. It serves as an indicator of inflammation and is associated with atherosclerosis and other cardiovascular conditions. High sensitivity CRP are more sensitive than regular CRP testing. HS CRP, which is high sensitivity CRP, is used to assess the risk of MI and stroke, even in individuals with normal lipid levels. Homocysteine is a naturally occurring amino acid produced by the breakdown of proteins in the body. Elevated levels of homocysteine are associated with oxidation of LDL cholesterol, which can contribute to plaque formation in arteries and the development of atherosclerosis. Central venous pressure is measured via a catheter inserted from a peripheral vein, such as subclavian or jugular, into the right atrium. It reflects the pressure within the right atrium and indirectly the right ventricle's pumping effectiveness. Increased CVP indicates right ventricular dysfunction or fluid overload, while decreased CVP suggests dehydration or hypovolemia. Pulmonary artery pressure, or PAP, is measured by a catheter being inserted through the right side of the heart into the pulmonary artery without inflating a balloon. This measurement reflects the fluctuating pressures during the cardiac cycle. Elevated PAP indicates pulmonary hypertension, which can result from various cardiovascular diseases like left heart failure or chronic pulmonary conditions. Assessing how well the cardiopulmonary system is delivering oxygen to tissues is essential for managing respiratory and cardiovascular conditions. Pulse oximetry measures the saturation of oxygen, or SpO2, in hemoglobin by passing light through tissue and measuring its absorption at different wavelengths. Some advantages are that it's non-invasive, provides continuous monitoring of oxygen saturation and heart rate, but limitations can be accuracy can be compromised with decreased arterial blood flow, low perfusion, or conditions affecting light transmission through tissues, such as nail polish or cold extremities. The device's accuracy is typically plus or minus about 2%. Again, pulse oximetry, or SpO2, measures oxygen saturation in blood. Normal is about 95 to 100%. Less than 90% may indicate respiratory or cardiovascular issues. Arterial blood gases, or ABG, is measured by blood being drawn from an artery, usually the radial artery, to measure the dissolved oxygen and carbon dioxide levels, as well as pH, bicarbonate, and base excess. ABG analysis provides a comprehensive understanding of oxygenation, ventilation, and acid-base balances. It is used to check oxygen, carbon dioxide, and acid-base balance in critically ill patients. Some of the key parameters in ABG are pH, which reflects the acid-base balance in blood. A low pH indicates acidosis, and a high pH indicates alkalosis. Partial pressure of oxygen, or PaO2, indicates the oxygenation status of the blood. Partial pressure of carbon dioxide, or PaCO2, reflects the efficiency of ventilation and CO2 removal by the lungs. Bicarbonate reflects the kidney's role in maintaining acid-base balance. A high level suggests metabolic alkalosis, while a low level indicates metabolic acidosis. Base excess is a measure of buffering capacity in the blood. A positive value indicates alkalosis, and a negative value suggests acidosis. Here is a summary of cardiovascular tests and what they are measuring for. Hormonal imbalances can affect patients seen in physical therapy, with hypothyroidism being the most common. The thyroid hormone is essential for growth and development. Newborns are screened for hypothyroidism to prevent cognitive delays. In adults, hypothyroidism slows metabolism, causing cold sensitivity, dry skin, bradycardia, constipation, and cognitive changes. It is also linked to musculoskeletal injuries, depression, and anxiety. Severe cases may lead to coma. Hyperthyroidism, often due to Graves' disease, can cause atrial fibrillation and eye protrusion. Parathyroid hormone regulates calcium levels by releasing calcium from bones when blood calcium is low. Cortisol and ACTH are involved in stress response. ACTH from the pituitary stimulates cortisol release from the adrenal cortex, increasing blood glucose and suppressing the immune system. Antidiuretic hormone, or ADH, affects fluid balance. Excess ADH leads to fluid retention and hyponatremia, while low ADH causes extreme water loss and hypernatremia. Renin, angiotensin, and aldosterone may be tested in cases of hypokalemia, muscle weakness, hypertension, or hypotension. Urine is 95% water and 5% solids, mainly water, urea, and sodium chloride. It reflects metabolic processes and can indicate various health conditions. Key components of a urinalysis include color and appearance. Pale yellow is normal. Darker yellow or gold or orange is dehydration, liver disease, or from medications. Red, purple, or smoky can be an indicator of blood in the urine, kidney stones, infection, or cancers. Cloudy and pus-filled can be an indicator of a urinary tract infection. Specific gravity measures urine concentration. Low or diluted urine close to 1.0 can mean excessive hydration or kidney dysfunction. High concentrated urine up to 1.2 can indicate dehydration. Abnormal levels may indicate kidney issues. Glucose in urine is an indicator of high blood sugar, like diabetes mellitus. Ketones in urine indicate inadequate glucose metabolism seen in diabetes or starvation. Urinalysis helps diagnose kidney function, metabolic disorders, infection, and hydration status. Microbiological studies help identify infection-causing pathogen, guiding treatment and isolation precautions. Some of the tests include a Gram stain, which differentiates bacteria. Gram-positive is an example of Staphylococcus or Streptococcus. Gram-negative may require different antibiotics. Other strains include potassium hydroxide, which can detect a fungi, or acid fasting statin, which can detect Mycobacterium tuberculosis, also known as TB. Cultures identify bacteria in blood, sputum, pleural fluid, the throat, urine, skin, wounds, stool, cerebrospinal fluid, the cervix, and the urethra. They must be taken before antibiotics to ensure accurate results. Quantitative cultures, where tissue biopsy or fluid aspiration is collected, measure bacterial load. More than 100,000 organisms per gram indicate infection risk. Blood cultures check for systemic infections, especially in patients with catheters or persistent fevers. Wound cultures are collected through a swab culture, which detects surface bacteria but may not show deeper infection, or biopsy or deep fluid samples, which provide more accurate results. Pulmonary function tests, or PFTs, help screen and diagnose pulmonary diseases, detecting airway, alveolar, and vascular abnormalities early. They also differentiate between obstructive and restrictive lung diseases. Some of the types of PFTs include static lung volume, which is measured by spirometry, tidal volume, which is the air inhaled and exhaled in normal breath, inspiratory reserve volume, which is the extra air inhaled beyond a normal breath. Expiratory reserve volume is the extra air exhaled beyond a normal breath. Residual volume is the air left in the lungs after full exhalation. And functional residual capacity is residual volume and expiratory reserve volume combined. Total lung capacity is tidal volume plus inspiratory reserve volume plus expiratory reserve volume plus residual volume. Dynamic breathing tests include forced expiratory volume in 1 second, or FEV1. This measures how much air can be forcefully exhaled in 1 second. Forced vital capacity, or FVC, is the total air exhaled forcefully after deep breath. And the two combined, so FEV1, FVC ratio, helps distinguish between diseases such as obstructive diseases and restrictive diseases. Peak flow meter, which is commonly used for asthma, measures maximum airflow during forced expiration. It uses color zones where green is normal, yellow needs intervention, and red means to seek emergency care. Fluid analysis is done through fluid samples, which are collected from various body compartments to diagnose infections, diseases, or abnormal accumulations. Cerebrospinal fluid analysis is collected via a lumbar puncture, also known as a spinal tap, which helps diagnose meningitis, multiple sclerosis, brain hemorrhage, and tumors. Normal CSF is clear and nearly cell-free. Abnormal CSF findings can be cloudy, which indicates infection, yellow or pink, which indicates bilirubin or jaundice in blood, such as a hemorrhage. Low glucose equals can indicate meningitis or cancer. High LDH can indicate meningitis. Low endorphins are linked to chronic pain. Synovial fluid analysis is collected via arthrocentesis, where a needle aspirates or removes fluid from the joint, commonly done in the knee. It helps to diagnose infection, arthritis, gout, or trauma. Normal fluid is clear, colorless, and viscous. Abnormal findings include cloudy or watery fluid, which is an indicator of inflammation, pink or red fluid, which is an indicator of bleeding in the joint, and high white blood cell count, which is an indicator of infection or inflammation. Pleurocentesis is where lung fluid is removed to help diagnose infection, cancer, or inflammation. Pericardiocentesis is where heart fluid is removed and can relieve pressure or diagnose pericardial disease. Hemopericardium is blood in the pericardium and is life-threatening. Peritoneal fluid analysis is aspirating abdominal fluid. A paracentesis is where fluid is withdrawn to help diagnose hepatic failure, infection, or cancer. Fluid is tested for infection, cancer cells, and electrolyte imbalances. Back to our question at the beginning, a PTA is working with a patient who has a history of chronic kidney disease. The supervising physical therapist orders a review of the patient's blood, urea, nitrogen, and creatinine levels. What is the primary reason for assessing these lab values in this patient? The answer is B, to determine the patient's hydration status and kidney function. BUN and creatinine are commonly used to assess kidney function. Elevated function indicates renal impairments, dehydration, or other conditions affecting kidney filtration. Since the kidneys play a critical role in maintaining fluid and electrolyte balance, monitoring these values helps determine if the patient is at risk for complications such as fluid retention, metabolic imbalances, or fatigue, all of which could impact physical therapy interventions.